Okay. All right. Well, welcome everyone. It's 2021 and I'm super excited to kick off K Club in this new year. New optimism and new grant opportunities are before us. So today we're here to hear about the top 10 pearls for abstract submission. And I'm going to go ahead and do a couple of housekeeping things before I introduce our esteemed speaker. So first of all, the survey. So the survey, as many of you loyal K Clubbers know, is the way that we thank you for giving us feedback and for giving us ideas for the coming semester of K Clubs. We do K Club for you. We want to make sure that it hits all the right marks and is exactly what you want to hear and what you want to learn about. So we incentivize you to answer the survey at the end of today's K Club by offering you, dangling, if you will, this awesome new K Club water bottle that highlights the fact that we've been together since 2009. So what we do is for the survey respondents from last month, Barbara puts them into the Crown Royale bag and repurposed as the K Club survey bag, and she will draw a name out and let us know who won the survey from, or who wins the mug from last month's survey. And who is the lucky winner, Barbara?
It is Summer Bottini.
Yay, Summer. Congratulations. Barbara will figure out how to get this to you because her specialization is logistics after all. So thank you so much, Summer, for your feedback. And again, Barbara will send the survey link pretty much immediately after today's K Club. And we ask you just it takes literally 45 seconds to fill it out. And so we'll really appreciate you giving us your feedback and ideas for future K Clubs. We also like at the beginning of K Clubs to tell you about a couple of K Club specials, which are grant opportunities and other research related opportunities that sort of hit the sweet spot of where we expect you all are in your careers. This is just a reiteration of March, but it's really important for everyone to see the Georgia CTSA opportunities. This one here, the TL1 is the T32 like that's for pre-docs and postdocs. There's also, of course, one that's more along the lines of a K awardee. So the KL2 is sort of like a pre-K23, if you will. Deadline for that is March 1. I have this month, I have a couple of specialized special K Clubs, K Club specials. We have one for pediatric researchers, the Thrasher Research Fund Early Career Award, an Emergency Medicine Foundation Early Career Research Development Grant, a neuroscience fellowship related one, and the American Heart Association. And the American Heart Association in particular, as Dr. Oster can attest to, is a really great, they have a lot of really wonderful early career development opportunities. And it doesn't always have to be directly related to cardiac, for example. The couple of years ago, we had someone in pediatrics who was an HIV researcher, and she proposed a research project that had to do with cardiovascular function. That was one of the measures, and she was funded. So you can always think about creative ways to really apply to these different funding opportunities to make sure your focus fits the funds. Finally, I just want to reiterate, this is one that we put forth last month as well. These free online trainings for clinical research professionals that are on the Georgia CTSA website. It's sponsored through Georgia CTSA and the Southern California CTSI. This is really a great free, self-paced and free opportunities. I put up a couple example programs up here, but there's many, many more. The link looks a little bit odd, but I promise you it works. So you can check that out and sign up for a bunch of continuing education through this link. Finally, my final shameless plug is for our pediatric conference that's coming up this June. It's our 10th annual Southeastern Pediatric Research Conference. The theme is paradigm changing innovation and promoting health equity. Now, anyone who's doing child health related research, we want to hear from you. We want you to participate. We want you to come. It's really geared towards being of interest to researchers of any type, basic scientists, clinical scientists, outcomes researchers. The abstracts are due March 1st. And so it's part of the impetus for why we invited Dr. Oster here today. You know, sometimes with K Club, or many times, we focus on the actual grant submission, putting together the best grant submission that you can. Sometimes we'll focus a little bit after that, maybe K to R transition. And occasionally we'll focus on something before then. So really thinking about, what does it take to put in a good grant application? Well, you have building blocks that build up to that. So you need to have some high quality publications in order to build upon that and show that you're worth an investment and that you actually can do what you say you're going to do. And then prior to that might be when you get your data, putting it into a high quality abstract to present at a meeting, because that's where you really get the feedback and understand maybe what are the alternative interpretations of the data, what are the questions people are going to ask, so that you can put that into your publication, so that you can put that into your grant grant application. So I hope I've convinced you that putting in a high quality grant research abstract will help you get your grant. And I think that is not a hard sell. So with that, today, I'd like to introduce our speaker, Dr. Matt Oster, who is a pediatric cardiologist in the Sibley Heart Center. He's associate professor. He received his MD from Vanderbilt, and he did his residency in pediatrics at UCSF and his fellowship at pediatric cardiology at Emory. He also has an MPH in epidemiology from Emory. I've known Dr. Oster for a number of years, and just recently I took over co-directing our Fellows Introduction to Research training, and I had the opportunity to go back over the years and see who all the speakers had been. And I noticed that Dr. Oster, who gave a similar abstract talk as well as a manuscript talk of the top 10 pearls for each of those areas at first. And the reviews from the fellows were across the board, the highest and most enthusiastic. It's a very valuable talk. He speaks in a really accessible, interesting, and valuable way. And so I'm super happy to introduce him to our K-Clubbers today. And we really want to thank you, Matt, for coming to talk to us about your top 10 pearls for abstract submissions.
Great, thank you.
And then as you put up your slides, I'll say, anyone you'd like to go ahead and put in you can just unmute yourself if you'd like to ask a question, or put it in chat, and we'll make sure that we get to as many as we can. But do it along the way. Matt said he doesn't mind being doesn't mind answering questions along the way.
All right, great. So you see the slide up there. Let me know when I start it, whether you still see the full presentation or whether I need to change the presenter mode. Do you see the full screen, Stacey? Yes, okay, great. All right, thank you very much for inviting me to talk to all the top 10 pearls for writing an abstract. Typically I give this in a small group setting, and it's very kind of informal. So please feel free, if you have questions, go ahead and you can just interrupt me, or you can ask at the end. So this is the top 10 pearls for writing an abstract. This is kind of a corollary to another talk I give on top 10 on writing a manuscript. And got a lot of questions over the years about specifics about abstracts. I created a separate presentation. A couple of disclosures, as with any presentation. All right, first and foremost, I do not have a degree in English, journalism, or any other field related to writing. I was a biomedical engineer, although I did have a minor in classics. I do not have any formal training in how you should be edited. For that, I'll defer you to the GEM score for any grant editing and manuscript submissions, or helps with that. And then the most important thing is, though, that this is my opinion and my opinion only. There is no one right way to write an abstract. If you are looking for one right way, the short answer is that the right way is the way that your mentor tells you to write it. But there are many different feelings and opinions when coming to abstracts. So I'm just going to give you mine, but they are by no means set in stone, and they certainly can change and adapt depending on situations. So before I get into the pearls, I'd like to talk about why an abstract. Why do we write abstracts? Well, most of you probably read abstracts all the time, all right? And abstracts for manuscripts, they serve a couple of purposes. So first, it's a teaser, all right? It's kind of a quick summary of your overall manuscript. It's like the cover of your book, where you're trying to draw the interest of the editor. When you're submitting a paper somewhere, editors are inundated with manuscripts that are submitted, and they're often just reading the abstract when they're deciding whether to send it out for review or not. And so your abstract needs to be interesting and also summarize the paper. But it also has to stand alone, because a lot of people will only read the abstract. When they're searching through PubMed or they're getting things emailed to them, they may not have the time or the interest to read the whole manuscript, but many will read the abstract and try to get the gist of what you're trying to say. But another reason why we write abstracts is to get accepted to a conference. You know, all you're judged on is your abstract, so make it count. And that is what we're going to focus on today, writing abstracts to be accepted at conferences. Okay, so number 10, pick your conference. Where are you going to submit? So I typically give this talk in October, right before Halloween. So this presentation usually has 10 pictures of my kids in costumes over the years, and I might be in a couple. And then another one, the other presentation has different pumpkins we've created over the years. But it is not Halloween, so this is inappropriate. So instead, you're going to get birthday cakes, because today is my birthday. I won't say how old I am, but you'll get to see some fun birthday cakes. All right. So first, pick what conference you're going to submit to. I shared this list with our fellows. I guess another disclosure I should have given you. Stacy introduced me to pediatric cardiologist. There will be a cardiology bend to this talk and cardiology examples, but hopefully they're applicable to a number of different specialties. Some of these are, very broad pediatric ones like AAP and PAS. I also threw Southeastern Peds here. As Stacy mentioned, the conference is in June and the abstract deadline is March 1st. So timing, kind of when you're getting your data will help you decide where you're going to submit to. Also, pre-COVID, I used to always say, not going to lie, look at not just the conference, but where it is. If the conference is in Honolulu and your department's willing to send you anywhere in the US, that might be a good one to approach, to submit to. So look at the conferences and be, aware, what are the big areas in your field where people are discussing the latest research or have important networking for your career. And based on the conference, review the abstract guidelines. We're going to get into this a bit. But what's their word count and character count? Can you have tables and figures? How do they want to organize? We're going to go through that in just a bit. But when you're picking your conference, I do want to say this. It's typically not okay to present work at too large conferences, especially too large academic research type conferences. A classic example for this, in the cardiology world is, a lot of our fellows, I encourage them to present at AAP. There's actually a lot of cardiology abstracts at AAP, less so PAS, a little different for most specialties. But that submission deadline is in April, and you usually find out in July whether you're accepted. American Heart Association deadline is June. You usually find out in August whether you're accepted. So there's a period there where you're not sure whether you're accepted to AAP, and some people also submit to AHA. And I have seen on a few instances, people present the same work at AAP in October, and then the following month at AHA in November. And that's really not a good thing to do. You're taking away an opportunity from someone else. I know people are trying to hedge their bets, present at two places at the same time. But it's really not a great thing to do. I will say though that, and back up, not just does it not look good, those large conferences do not want you presenting anything that's presented anywhere else. I think those large conference organizers did not know necessarily that people were presenting at two places, but they want research that is going to be presented there to be new, at least to the attendees and to the audience that they are trying to attract. That being said, second bullet here, it's okay to present at smaller conferences. And I put Southeastern Peds in that bucket, all right? Just because you present to Southeastern Peds does not mean you cannot also submit your abstract somewhere else. Or if you've submitted an abstract and presented it at like PAS in May, that doesn't mean you can't also present it at Southeastern Peds. Southeastern Peds is meant to share more important information. And it's more collegial and very low stress environment. It's a good conference to go to, especially and to present at, especially early in your career, to get some good experience with abstracts. For the larger conferences, as I mentioned, they don't want work that's been presented elsewhere. Also, they do not want work that's been published anywhere. It is okay to submit your abstract somewhere, and then if you write a paper, submit it. And if you find yourself in the enviable position of having a paper accepted and a journal wants to publish it before you have a chance to present it at a conference, you can ask the journal to hold off that publication until conference. And a lot of journals actually kind of like that, because then their stuff looks really timely if they are publishing the manuscript of an abstract that's being presented at the same time as a conference, maybe even sometimes the same day. So that's an okay thing to do. Quick aside, I mentioned to give a manuscript talk. I think this is appropriate here. My advice when I am teaching my fellows when to write their manuscripts and what their timeline should be, there's usually a big lag between when you are, submitting your abstract and finally getting around to writing the paper and submitting it. And I tend to recommend that, unless it's super timely, like COVID stuff, people are trying to get out really fast. Between the time of when you submit your abstract and you present at a conference, that is a great time to actually write your paper, because you're never going to know your stuff better than right after you've gone through all the analyses. And then when you go to present it, going through the paper makes you really familiar with all the research that's out there, makes you think of all the holes that could potentially be there and questions that people can ask. And then when you go to the conference, that's like a quick little review, and you like of other people reviewing your work. You can go back and add to your paper anything that came up, and then submit it and get it out the door. And maybe at the conference you run into some people who give you some kudos on your work. Remember their names too. You can suggest them when you're asked to recommend reviewers.
Could you give a quick share your philosophy with everyone about your ratio of abstracts to manuscripts? I found that interesting when you talked at first.
Oh yeah. So we talked about getting abstracts out there, and publishing a lot of abstracts is good. Getting your work name out there, that is really good. But in the grand scheme of things, you're really going to be judged big time on your papers and your manuscripts and your overall contribution to peer-reviewed literature. I got this piece of advice from someone a number of years back that they don't want to see more than double the number of abstracts as manuscripts. And that's a moving number depending on how senior you are and how many papers and abstracts you presented. But the take-home message is that lots of abstracts with much fewer manuscripts is the sign of someone who doesn't complete the job, who doesn't get the job done, take things across the finish line, and see things through. If it's good enough to submit an abstract, usually you can make a paper out of that and get that submitted somewhere. It's a lot easier to get an abstract accepted somewhere than it is to go through the whole process of a paper. Okay, pick your section focus area. For this cake, many of you have probably saw last year the whole phenomenon of the real or nah, some YouTube videos on that, about things that look like real things, but they're actually cake. This is a hamburger that I like. There's Crocs, there's bananas, there's many different things that you can go and have fun with, trying to figure out, is that a cake or is that real, something real? Okay, so when you're submitting to conferences, I mention this because this can help you in the overall review and acceptance to some conferences. This isn't always an option, but sometimes it can be straightforward. If there's multiple possibilities, choose strategically. So I give the example, American Heart Association. We'll do some outcome studies on long-term outcomes of kids after like surgery for transposition of great arteries or something. Well, there are a lot of cardiologists that go to AHA. There are some surgeons that go. Not nearly as many surgeons go, those cardiologists. But there's a surgery abstract section. So if you submit to the surgery abstract section, though, you are competing against a smaller pool of people. So sometimes if my abstract has something surgical, I'll make it go into the surgery section, even though it could be applicable to something else, the long-term outcome section, childhood health section, those sorts of things. So that is going to be very dependent on conference, but it's just something to think about the first thing that comes to mind might always be the best strategic one. Your mentor can help you with this because they have experience in going to the conferences. Okay, I got my birthday wish yesterday. I am from New Orleans and the Saints won. I'm a very happy diehard Saints fan. And this is a lovely Saints cake. I mention this because some people don't appreciate that this is an option to do. And I tell fellows, always, always, always choose this if it's an option to you. Like for AAP, for the cardiology section, you just need to check a box that says, I want to be considered. And then they'll let you know whether you're in. Young investigator competitions differ by the conference. Many conferences want a manuscript to be submitted with the abstract because they're going to use that in judging who's going to be a young investigator. Some want a CV, some want letters of recommendation from mentors or other people you've worked with. When you need those materials will differ. Some want a manuscript. They want everyone who's submitting to the Young Investigator competition to submit a manuscript, and that might even be 5 months before the conference date. Others might say, oh, only submit a manuscript if we accept you into the competition, and you need to submit your manuscript, say, 2 weeks before the conference. So pay attention to that. But that's a nice, easy thing that for you to consider. That looks really good on your CV. Even if you're just a finalist for the Young Investigator. Even if you don't win, you can say that you were a finalist for the competition by getting into that. All right, next, understanding the review process. If we were in person, I would ask if anyone knows what kind of cake this was. I give you major kudos if you did. This is building upon the New Orleans aspect. I did not know that this cake is unique to New Orleans when I was growing up, but apparently it is. This is a Dauberge cake. D-O-B-E-R-G-E, and is made by layering many different layers of cake there, as you see, with a little bit of pudding in the middle of it. So very thin layers of cake with a thinner layer of pudding between it. So nice, so fluffy, so decadent. Traditional flavors are chocolate and lemon, often half and half. I save the lemon for other people. I'm definitely a chocolate fan. Okay, so what is the review process? And then this is, again, going to vary by different conferences. But typically, there's a panel of reviewers that the conference will reach out to, and it's typically people who presented at that conference before in the past. And they'll ask you to give a score of each abstract. And some might just say, give a score 1 to 10 for each abstract. Or some will say, give a score 1 to 100. Some will say, give 2 points on the different elements. We want 2 points for the background, 2 points for the methods, 2 points for the results, 2 points for conclusion, and then give us another 2 points for overall and add that up, and that's a score. They're going to vary. But most conferences are at least going to give you some idea of what they're looking for, and you want to make sure that you can check all the boxes, and we'll talk about that in a second. But understand that this is a little bit different from when you're reviewing, submitting a manuscript. When you submit a manuscript to a journal, they're going to send it out to reviewers, and that reviewer might only be, reviewing one manuscript at a time. They may spend, anywhere from 1 to 3 hours reviewing that manuscript, sometimes longer, and looking at all the different aspects and really trying to write a nice, thorough, and hopefully helpful review. With abstract, it's not that way at all. You could be asked to review 30 to 50 abstracts and maybe told, we need your reviews within the next 2 weeks. And someone might block off 3 hours to review them all. So you need to stand out. And you want to stand out in a good way, not a bad way. And part of standing out, in a bad way, I'll say, is formatting inappropriately. So make sure you format it appropriately. If the conference has guidelines, and most of the abstracts are formatted that way, and yours is different, people are going to notice, and it's going to be a sign of someone who didn't read the instructions, who isn't really committed to submitting this. So I listed here the instruction for Southeastern Pediatrics. They're great. It tells you right there, these are the 4 sections we want: background, methods, results, and conclusion. That's pretty standard. Some want a separate objective. Some want, separate hypothesis section. They tell you your max is 350 words. Southeastern Pediatrics has plain text only, so they do not allow figures, graphs, or tables. Many conferences and places do. This is one big thing that is different from a manuscript, is that many conference abstracts, you can submit a key figure or a key table. And I'm going to talk about the utility of that in a little bit. And Southeastern Pediatrics wants to make sure that the name of at least one mentor is in your author list. And then it expands upon what they want in background, methods, results, and conclusion. And gives a little bit more in detail about what each thing is there. And that bottom says, what else? Proper formatting according to the instructions. So really try to get good formatting, pay attention to what they want, and have people review your abstract. I know a lot of people are writing abstracts at the last minute. Try not to do that. It does show up in the final product. Okay, next one. My kids are a big fan of the TV show Nailed It, if you've ever seen that. So on the left, obviously, the goal of the project to create a SpongeBob cake. And on the right is, yeah, typically if I were to bake a cake, this is what it would come out looking like. Okay, so how are you going to title your abstract? You know, when you title manuscripts, and I give a talk about this later, you know, it's usually pretty straightforward, something that's going to be in the, you know, table of contents or show up in a search engine. So you want key, you know, some of your prime keywords in your title. You know, it's something to really tell people what it's about and should they go review more. Title for an abstract has some of those same goals and characteristics, but a little bit more is you want to grab people's attention. You're competing for someone else's, against a bunch of other people at the same time when someone's reviewing your abstract, number one. So you want to stand out that way. And then number two, when it comes time for the conference, you know, people are looking through all the abstracts that they might, and posters they might go visit. The title needs to stand out right there so people can come and see your poster and come and chat with you. So some ideas that I've, you know, seen in the past and have used myself. So one idea, ask a question, you know, is, you know, you have a research question and you're posing a research question. Hopefully you're answering it. By asking a question, you're piquing someone's interest. They're like, oh, that's a question I have too. I'm going to go to that and learn about it rather than just giving away the answer in your title. Second, state of controversy. Is there something in the literature that people are unclear about, or you know, people are arguing about, or have you found something new that's different from things in the past? You know, make people know that so they can understand that, hey, this is a little bit different from typical stuff they've read or seen. And then finally, if you have a very, you know, big data set, or this is a really high quality study somehow, either because of the multi-center aspect of it, because of the newness of it, or because of the data used or something, mention that, let it stand out so that people know, oh, this sounds like it's going to be a really important study. I better go learn about it. So here are some examples, again, from a cardiology world. So transcatheter versus surgical closure of atrial septal defects in children, a value comparison. So we want to highlight that this is a value test, because that was a big, you know, hot topic these days. What is the value in medicine? Newborn screening for critical congenital heart disease, is it time to change the algorithm? That one ended up winning a Young Investigator Award at AAP. People were really interested, like, oh, wow, this might be an abstract that is, again, I have a direct impact and change in practice by changing the algorithm. Spoiler alert, we have changed the algorithm, partly because of the data from that abstract. Association of congenital heart disease with autism, a case control study. We don't see many case control studies, so we want to highlight this. This one also won a Young Investigator at AAP. Pediatric cardiology, evaluation of chest pain. Are we meeting pediatricians' expectations? Again, there's a good example of a question. Here's one talking about a great data set we used. Long-term transplant-free survival for arterial switch versus atrial switch and treatment of transfers to the great arteries. A study for the Pediatric Cardiac Care Consortium, which is a group of about 50 different centers around the country. So you have lots of, you know, ideas and options when you're coming up with the title. But try to have something that's a little bit interesting. All right, Now let's get into some of the nitty gritty of writing your abstract. So this is introduction and background. I thought it was appropriate for peds talk. Very hungry caterpillar as a cupcake birthday cake. All right, intro and background. You do not need long introductions back. You don't need long introductions in your manuscript. You don't need them in your abstract either. 2 to 3 sentences max, it's fine. First sentence or 2 can be a very brief intro to the broad problem, but definitely want to see, like when I'm reviewing abstracts, I'm looking for a sentence in that, background or intro of purpose, objective, or aims. I want to see something that says, the purpose of the study was, or we aim to, or the objective was. I want to see something like that so it can be very, very clear. You might think it's intuitive, and by your title and what's going on, it's intuitive, but I like to see that right there, because when it comes down to conclusions, you're going to want to refer back to that and say whether you achieved the purpose or not. Not explicitly, but in what you're saying, people will know whether you achieved that purpose or objective. And then if you have room, you can add a hypothesis. Southeastern Peds guidelines say to put that in there. Again, if you have room for that, some are much more constrictive for how much you can put in there. Especially the hypothesis is very, if it's straightforward, you don't necessarily need to have that in there. If it's unclear, like value comparison, you're comparing, say, surgery versus cath, and you're not sure what's going to be there, it's good sometimes to put your hypothesis. Very cool to see sometimes if you put your hypothesis and your results disprove that, and you find something against that, and your conclusions you can come back to and say, we actually found this, even though we thought we'd find that. All right, so some examples here. In the top background, skeletal ASDs or heart defects with both transcatheter and surgical options. Okay, very broad intro. While both options have shown great results, the value is unknown. All right, so we're introducing the key question. The purpose of the study was to determine which one offered a better value proposition. Okay, very straightforward there. Down below, the newborn algorithm one that I talked about. Most commonly used algorithm for newborn screening for critical congenital heart disease is the one endorsed by the AAP. Look at the impact and feasibilities when questioned. Then we have 2 objectives. We put them both in there. Objectives were 1, determine the impact of that screening in a large hospital, and then 2, model what the impact may be under an alternative algorithm. An autism study we did down below, background, association with heart disease in general, neurodevelopmental delays, association with CHD and autism spectrums understood. Prior have been less, have been limited. Then the objective was a separate section in this abstract. So specifically, there was an objective using administrative data from the military health system. We sought to identify the association between CHD and autism and to identify specific CHD lesions with higher odds. Very clear, readers know where we're going with this. All right, methods. Okay, so I'm going to take liberty and cheat a little bit here, but I love bananas and banana desserts. On the left, bananas Foster after it's been flambéed. Very cool to see. Also a New Orleans thing, and my family made this for me last night, which is wonderful. On the right, banana pudding. Also something I love. My family's made it before in the past. I don't know what they've made for me tonight, but they told me not to look in the foil that's in the fridge, which looks like a banana pudding dish that we've used in the past. So we'll see. All right, methods. Start with the type of study. Fellows or early career investigators, at least clinical studies, lab studies, very different. Not my expertise, but talk to your mentors about how to write that. But for clinical studies, 99.5% of what you'll be doing is retrospective cohort studies. Rarely, case control studies. Sometimes, especially now in the time of COVID, when we're just describing what we're seeing, you can have more descriptive studies. That's still a very new thing that's being described to understand the disease. One point here I would like to make. I see a lot of people sometimes put, we performed a chart review study. Chart review is not a type of study. Chart review may be in the methods that you use to conduct your study. Usually when you're saying we did a chart review study, you're saying we did a retrospective cohort study. And so you perform chart review to do that study. The chart review is not a study design. That's a common mistake I see, so try to avoid that. Other thing I will say about the methods that I don't have here, I see a lot of places, and even I was taught way back when, use passive voice. That's definitely a style thing. I, over time, have definitely come into the active voice camp, that if you performed a study, take credit for it. Say we performed, or we did, or we looked at this thing. I still have a hard time getting some people not to do that, and I'll let it slide. But when I write my abstracts, I like to use active voice instead. Again, that is clearly a personal preference thing. Include broad details in your methods. What were your inclusion/exclusion criteria? If you can say that succinctly, it's very nice to see in there. Definitely want to see the years and location of the study. That's often omitted, especially the years part. We need to know the recency of the data. Include broad type of statistics if you can. If you have room, list any other kind of details like the confounders that you had. That can be hard with space constriction, but I'll show you all later a little trick that you can use with your tables and graphs to kind of get around that if you need to. Yes, active voice, as I said there, I talked about that. You don't need to include IRB in your abstracts. That does need to be in your manuscripts. You don't need to put that in your abstracts. That takes up space that you don't need to do there. A couple of quick examples. I'm going to try to go through these quickly, but this again is the ASD closure one. Using data from the Pediatric Hospital Information System for 2004-2012. Boom. So right there, we know what data set this is, and most people are familiar with FIS, which is a large, multi-center administrative database. We looked at the years. Okay. We've got our age range, which is important in pediatric things, so children age 0 to 17 years, with value being defined as outcomes relative to cost. If you have important terms that need to be defined, go ahead and put those in there. Our outcomes of interest were in-hospital mortality, length of stay, and rates of infection. So right there, we told people what we're really looking at. How do we deal with charges? So a little bit of detail with the statistics. How do we look at continuous variables? And then, we knew that there were some concerns or questions about cost. So we threw, how we dealt with the non-normal distribution and variance. We thought that was important to have in there. This is the newborn screening one that I talked about. This one does use the passive voice. Newborn screening were collected on term infants at a large tertiary hospital in Atlanta. There's your location, the dates, 2013, 2016. Who was excluded? So we said that, which patients were excluded, either from just collection and from the analysis. Reviewed clinical records, that's kind of your chart review. And then a simulation study was performed. This is the autism case control study. We performed a 1 to 3 case control study. So that's great. We're telling people right away what kind of study we did. Enrolled in the U.S. military health systems. There's our data source. From October 2007, September 2013, there's our years. Okay. We did matching here. So we said how they were matched. So matched on date of birth, sex, and enrollment timeframe. How do we identify CHD codes? So here we said we used ICD-9 codes, the best we had. And then a little bit about specific statistics after that. All right, down to number 3, results. All right, this is a cookie cake. Unfortunately, I could not find a picture of the cookie cake that my family baked for me a couple of years ago, but I always enjoyed this growing up. All right, results always start with the overall numbers, okay? I don't have here some of the editing and grant thing. You'll get that with time and see people, but you'll never start a paragraph or a sentence with numbers. So instead of saying, 100 children were enrolled, and you don't even need to say there were 100 children enrolled, you could just start by saying, of 100 children enrolled, comma, and then get into your result. Saves you a lot of space and gets to your numbers and doesn't start a sentence with a number. Get to the results quickly. Okay, you don't, and usually you can't report all the results. And then, if allowed, use graphs and tables. All right. Remember, I said you want to stand out. Reviewers are looking at 30 to 50 of these in an afternoon. If the abstract, they let you use graphs and tables, go ahead and use it. A lot of times, that's going to make you cut down on the text of your abstract. Some will say, a graph or table counts for 50 words, or some will say, oh, if it's a character limit, they'll say that counts as 250 characters. They'll say something there. But you can usually say a whole lot more with a graph and a table than you can with the same amount of text. So here's an example of a table that we used looking at outcomes of kids with congenital heart disease. And the key thing I want to show you here is we knew that we needed to define the term critical, because critical congenital heart defects. This is still early on CCHD screening. And what someone determines what is critical might differ from different cardiologists. So we just said, we just need to define it. We didn't want to take up all that space in our methods, so we put it in the footnote of the table, all right? And here it is. We put the footnote there. Down here, we say what all of the critical heart defects we included were. It doesn't count any more words or graphs to have the footnote or not have the footnote. Once you had the table, you had a set amount, no matter how big the table was. So we were able to include the information in there for reviewers and for the audience, but didn't need to spend valuable text space in the abstract. Another important table, we've got 5 major comparisons here where we can say they're all significant and what there are. If you were going to try to write all of this into the abstract text, it's going to take a lot of space. And it's really, to be honest, kind of a little cumbersome to read and go through all of that. But a table nicely organized can really be valuable. And from the same abstract, this was AAP, and they allowed table and figure. You could have one of each. They had no limit. And we came up with this really cool figure. Again, we also wanted to put a lot of stuff in the footnote, abbreviations, but we are able to show with a nice forest plot our results, in this pretty figure. Again, if this were all going to be the text, it'd be hard to show all this. We can show the N for every single sub-defect that we used. We can show the confidence interval. We can show the estimate here, the point estimate. We could have gotten fancier and labeled it more. We just thought it looked a bit too busy to have that. We thought you got to see a lot just by this. Okay, on to the conclusions. Ice cream cake, always a big fan, whether it's from Dairy Queen or Carvel or some other place, or if you're bold, try it home. All right, summarize your key point. Again, this must answer and address your key question and objective. I mentioned that in your intro or background, I want to see that key question or purpose statement, and your conclusion should answer that. Like, what did you find related to your research question? Don't just restate your results. It's right there. People just read it. They don't need to understand that again. Conclusions must be supported by results shown, though. This is, sometimes you'd be surprised if people do make this mistake. Remember, we said earlier, you just don't have the space to show all of your results. You just can't do it. And it's hard sometimes to know, like, all right, I did all this stuff. I know all these things. And your conclusion mentioned some finding that actually didn't make it into your results. If you're going to put the conclusion based on that in your abstract, make sure the result that is providing the data for that conclusion is in there. And then I like to say at least a second sentence, what are the implications you're finding? That's really a good option. If you can say how this might change clinical practice, how this might change how people think of something, how this compares to prior stuff, that can be really good. You will see a lot of them say further research is warranted to further evaluate these findings. I see that a lot. That's not going to make you stand out. It's kind of a cop-out and a weak way to say, I couldn't come up with anything better, so I'm just going to put this there. But people do it a lot. So try to come up with something with a little bit more oomph behind it. Okay. You can hedge what you say. You don't need to say that they have to change something. You can say may, or could lead to, or something like that. And you should always have a little bit of skepticism even in your own results. But just because you can't say anything definitive doesn't mean you shouldn't say anything valuable at all.
And if I may make a comment about that, Matt, As
Yeah.
a reviewer for the Pediatric Research Conference abstracts, that you're absolutely right. That tells me there's really not enough to put into the abstract in many ways. But I think that it gets back to your point about when you submit an abstract, you should be between, many times months and months between when you submit the abstract and the meeting. And so I think a lot of people want to be doing a lot more research in that interim to be able to beef it up. But in fact, something you said early on made me think that your advice is no, you should be pretty much ready to write the manuscript when you submit the abstract, because then you can be writing in the interim. Is that true? Do I interpret that correctly?
I like people to start writing, but if you find new directions or new things you want to add to it, totally fine. And I should take that another step, that if you know that sometime submitting you have incomplete data, or you've only had data on like your first 100, but you're gonna have 200 patients by the time the the conference comes around, that's fine too. Like, you can have your abstract in the first 100, and when it comes time to the conference, if you have more data than that to present, that's okay to do. You can present on the full slate. But yes, you should have a good sense of where your paper is going when you're submitting this abstract. A couple examples of conclusions here. This is that ASD closure one. Both transcatheter procedures and surgery have excellent mortality, but transcatheter procedures had lower length of stay and rates of infection, resulting in lower overall costs. So that really addressed our purpose and our objective to do the value comparison. Cath was lower, or higher value, lower cost. For children eligible, transcatheter closure may provide better value, at least in the short term. So that's what we found. That's the clinical implication. And we put the nice, I don't talk about limitations in the abstract, because normally that's not there. That'll be in your paper, in your presentation. But we kind of snuck it in the conclusion here that, hey, one limitation we're finding is we only looked at the short term, which is fine. If you want to make value comparisons of long term, this data is not right for you. This is the newborn screening one. CCHD screening using pulse oximetry may not detect new cases CCHD in tertiary care setting. We don't really see many new cases, but it can detect other causes of hypoxemia. So that was assessing the impact of its use. It found a lot of important causes of hypoxemia. And then our modeling results, modifying the CCHD screening algorithm to have only one repeat pulse oximetry test instead of two may help detect other significant disease without a substantial increase in false positive rate. That's our clinical implication right there, that, hey, if you modify the algorithm, this is what you might expect in clinical practice. We have further efforts here, but note, this is not further research is needed to substantiate these findings. This is further efforts are needed just to improve screening, sensitivity screening. We did find, since we didn't find many new cases, there's still some coarcts and other things slipping through the cracks, that overall screening could use some improvements. Autism, children with CHD are increasing odds of developing autism. That was our key finding. That's our purpose and our objectives. That's what we found. Remember, we said we were going to look at specific lesions. Here are the specific lesions that seem to have increased risk. And then how are they useful? Well, the big thing for this is counseling parents and caretakers, right? That way they can know to think about it, and also useful for providers to be aware of this and look for it. Okay, finally, dealing with rejection. May not know, January 6th is the start of Mardi Gras season, so happy Mardi Gras to everyone. I have our Mardi Gras decorations up outside. So growing up, my birthday cake was more often than not actually a king cake, at least at my birthday party. It was often the first king cake of the year you could have. Dealing with rejection, you follow tips above, don't be upset. There is a lot of randomness and subjectivity to the reviews, okay? It could just be, the mood of the reviewer that day. It could just be how much they had, like what other things were going on, whether the reviewer liked your overall just idea. Remember, the reviewer may not have had expertise in it. It's very different from a manuscript. A manuscript, you're asking like 3 people to review one manuscript, and an editor is really going to find 3 well-qualified people. Whereas in the other hand, for abstracts, you're asking one person to review 30 to 50 abstracts. It's impossible to be an expert in all of them. So the person may just not have understood what you meant in the abstract, and it's hard to really say it all. If you get something back and signed in and you still want to present it somewhere, improve data, get more data if you can, make it bigger, help analyses, think of other things you can do, improve the figures if possible. but I'll just give you this caveat. Consider resubmitting somewhere else. If you have time, depending how things are going along your process of submitting it. We have had 2 fellows who had abstracts rejected from American Heart Association, which would be very hard to get in, who then turned around and submitted it to American College of Cardiology and ended up winning Young Investigator Awards there. So, they made slight changes to their abstracts, but for the most part, it's pretty much the same abstract. It's just sometimes you get to review it. So don't get upset. There's a lot of randomness to this. It's very similar to grants, that sometimes you can do everything right and have a great grant. And there are always things you can improve, but sometimes there can be just some randomness. So key points when writing abstracts, always try to be clear. You don't have a lot of words and a lot of time to get someone's attention. Stay focused. You can't have all of your results in your abstract. Just try to have your key findings and really focus on that main research question and objective and show what you really need to answer that and focus on that. Be interesting. So from your title to your figures, try to make it interesting. And similarly, be memorable. Okay, there's a lot of abstracts that someone's reviewing at the same time. And you want people to come to your conference or come see your poster at the conference. So you need to be interesting. You need to spark their interest to take time out of the day to find you in the poster hall. And hopefully they'll be memorable when they do find you. So thank you. I do not have any of these cakes, thank goodness, but I did find these amusing. And I'm happy to take any questions.
Wow, I really want to look at your internet search history, just saying. Well, I don't see any questions in chat. Can we get some, people feel free to put your questions in chat now or unmute yourselves if you'd like to ask questions. While we're waiting a moment to see if anyone has questions they'd like to ask. First of all, I want to thank you so much. It's such a great talk, Matt. I've seen this talk before, in fact, just a few months ago, and I still learned something new. I wonder if I don't know if you've served as a reviewer before. I know you've served as a mentor plenty of times. Do you have any kind of most common mistakes that you see early career researchers making with abstracts that you can share with us?
Yeah, I've served as a reviewer for a couple of things, and some of those common mistakes fed into this presentation. So the formatting certainly comes up. And I hate to say it sometimes though, just the boringness, I'm reading a lot of abstracts. If your title, is kind of ho-hum, if you don't have, interesting tables or figures or everything, like it can be everything well done. And you could have done everything right if you just don't make it appealing to someone to look at when they're going through 30 to 50 abstracts, then, it's gonna be hard to stand out. It's tough sometimes too. Like I sometimes have to review abstracts that I'm not an expert in. All right. I try to not just say I can't review this at all, because I know that they want someone to review it. And so I'll try to give people a fair shake. But not being able to clearly articulate what you're doing and what you're finding can be a challenge as well.
Right. Do you, as a mentor, insist on reading your mentees' abstracts? And do you recommend that every mentee share it with their mentor or a trusted colleague before submitting?
Absolutely. So, in fact, I think all of your co-authors should review the abstract before it's submitted. So, it's, general practice that, for instance, I'll say, my other job, part of the times I work at CDC, and everyone needs to submit a formal email to CDC saying, I approve of this being submitted to CDC before it can go out the door. And I think that's a good practice just for people in general, just to make sure that everyone on your author list has had a chance to review it, weigh in, give their thoughts and ways to improve it, so they know what's going on and what's happening with that abstract.
All right. Well, I don't see anyone unmuting themselves. We do have someone in chat. Audrey Schlachter says, great talk. What tips do you have for making an exploratory study have more wow factor impact? Great question, Audrey. Is there a way?
Yeah, That is a great question. So things when you're looking at an exploratory study. So, first, what's different from others, right? So if you're often doing exploratory, if you think COVID, for example, a lot of people are exploring things. What's different from yours than what other people are doing? So that can be useful. That's one thing you can use. But wow factor and impact is, hopefully, if you're trying to publish an abstract for an exploratory study, you've got something interesting to say. Either what you found in your explorations, like some key new thing that no one's really thought of before, or you've got ideas for how this can go somewhere. Like, oh, hey, there's this little neat thing we did here, and you can even suggest in conclusions ways to build upon this might include, and you can suggest some different ways that people do it. I think if you can really connect those points for people to understand from an exploratory study why they should pay attention to it, that would be very useful to readers and to people who are looking at it at a conference. I'll tell you, give you an example. One of the most impactful papers that I ever did came from kind of an exploratory study that I saw someone present at a conference. They were looking at, they did a whole exploration of, medicines that might have a difference in helping improve survival for kids who had heart surgery between the first and second stages of single ventricle heart surgery. And they presented it at ACC in March, and they found that digoxin made a difference. And we looked at it, I was like, that's crazy. And they said, oh, there should be other ways, other people should look at this, and here are ways they can do it. So we saw their presentation. I thought, they're nuts. There's no way that that's real. And so we went to an entirely different data set, which we thought was more sound, more valid, did the exact same study, and found the exact same thing, and submitted it to American Heart Association. And it built upon that first study, and was really, the two of those together changed clinical practice. So now that all the kids are on digoxin, even before that, people didn't think it made a difference. So exploratory studies have a role and can be helpful, especially if you can say, what's the potential next step from an exploratory study? Don't just let it end with that.
That was a really inspiring example. Thanks for sharing that with us. Any other final questions for Dr. Oster? I do not see. So with that, I will go ahead and thank you again so much for your time and expertise. And just as a teaser for our February K Club, we'll be having a presentation on using graphics to enhance grant proposals. It's actually a pre-recorded session that Hanover Research put together. I watched it. I thought it was really interesting. I shared a lot of tidbits with some colleagues, and they agree that it's of value. And so we'll watch the pre-recorded session, and then the people from Hanover who put it together are then going to be on hand afterwards to answer all of your burning questions. So be looking forward to that. All right, well, thank you so much, everyone. And thank you again to our esteemed speaker, and hope you have a great rest of the week, and we'll see you next month.
Thank you.